Good morning, Dr. Anna.
Good morning, Michael.
Right. It's great to have you on our third episode for MHTC. So in last two episodes, we introduced a little bit of the department, which is working in Malaysia healthcare travel, right? So today you brought us a very special topic as you are responsible in this department. Can you tell us what would you like to introduce today?
Good morning, Michael. Thank you for having us again. And thank you for pronouncing my name correct, because usually they get my name as Dr. Noor or Dr. Binti. And I'm glad today Michael got my name as Dr. Anna. Well, I am responsible today to let all of you know on the cardiology treatment or the cardiology segment of what Malaysia has, and how to have all of us take care of heart. So there will be some healthy heart tips from my side to your side.
Excellent. Well, I know you have prepared some material for us. Let's go into the PowerPoint and have a chat on this topic.
All right.
Sure.
Let's see what do we have in the first slide that I've prepared. Bear with me. It will take about 5 to 10 minutes.
Yep.
Based on WHO, the number one cause of death in the world is actually heart diseases. So about 17.9 million of global death in total, based on 2016 of death are caused by heart diseases. All right.
Right.
And despite that now we have the pandemic issues that's going on, the COVID-19, heart diseases still holds one of the top number and cause of death globally. Our major functions of a heart, we usually divide it into four. So the first one, when we look into major functions, would be where we transport nutrients, gases, and waste products around the body. We also helps the body to protect from infections and maintaining the blood pressure. Then heart also helps to maintain a constant body temperature, so which means it's not too high, not too low, and also helps maintain body fluid balance within the body. And here would be some of the common causes of heart diseases, where globally, and especially in Asian countries, which are the coronary heart disease, patients with previous heart attack, high blood pressure, diabetes, irregular heartbeat. It could also caused by a virus infection or an overreactive of thyroid gland, and some reaction to drugs, excess alcohol intake, and also drug abuse. Next, we'll look into the general symptoms of heart attack. There's a few general symptoms for men and women. At the same time, there are also specific symptoms for women and men during a heart attack. The first general symptom for both women and men would be pain and discomfort in the chest, usually at the central area. Then you'll have a bit of lightheadedness, nauseating, and vomiting. And they will also have this jaw, neck, and back pain. And usually, this jaw and neck and back pains happens in women. Right. And then we have a discomfort of pain in arm or shoulder. As we know that our heart is on our left side, yeah? So this discomfort of pain in arm and shoulder usually radiates on the other side, not on the same side of your heart position, because this is your heart here. Yes. And the pain and the discomfort usually goes on the other side. Oh. All right. Okay. Sure. And then shortness of breath, which is very common in women and men.
Right. Okay, doctor. Well, as you're saying that these 5 are the common symptoms for the heart attack, but I'm sure that there are probably some differences between men and women, right? Can you tell us a bit more?
All right. For women, the pain threshold in women are higher compared to men. Sure. And generally, all men and women will develop the same symptoms like what I've shown on the slides. However, for women, they tend to have this gastric-like pain. So it mimics like gastritis. Indirectly, a lot of us will think we are having gastric instead of the heart problem. Next, when we speak on heart diseases, the first thing that comes to our mind will be heart attack.
Right.
And then there's also stroke. And stroke, there's also a general symptoms of stroke in patients. And it happens very fast in patients without you even knowing. All right? A person with strokes usually has balance difficulty. So it will have imbalance, so which means they can be wobbly. While standing, they start having this wobbly sensation. Next, their visions, they don't lose the vision, but they have this blurry of vision. At the same time, they have face asymmetry. So the face can be, they will have face asymmetry, and they will have weakness in their arms, and last, it will have their slurred speech.
Yep, I have a question. Well, what should we do if we have these symptoms then? Okay.
When you have all these symptoms in patient, if you have encountered any patients with stroke symptom, always remember FAST. FAST.
Right.
All right. The first thing that you watch out when you have a patient suspected of stroke is the face asymmetry. So, which means the face could be disproportionate. And then you look at the arms. The arm is really, really weak.
I see.
All right, and then you see the speech. The speech is always slurs, or the saliva coming out. So, and they can't speak in full sentence. And right after that, you need to call straight to the ambulance. I am not sure what is the practice in Hong Kong, but usually here in Malaysia, when you have all the symptoms, the first thing is to call up the ambulance and bring them straight to emergency department.
Of course.
Okay. All right, and it needs to be quick, so you wouldn't want to lose the time. All right. Next, based on all the stroke, the heart diseases, heart attack, we need to also be alert and be mindful that we need to be fit. We need to be fit but not fat. So how do we do it? Okay. First, we need to manage your blood pressure.
Yes.
All right. Next, we need to manage your cholesterol level, and then your weight. You have to maintain a healthy weight, and also your exercise regularly, which all can be done on daily basis.
Certainly. Can I ask you some question on the blood pressure? What's the normal range for it? And cholesterol level, what is the figures that we should maintain?
Okay. Ideally, if you normal blood pressure is 120 to 180. But as long as if it's a healthy patient, if you're talking about a healthy person, a blood pressure of less than 150 above and less than 90, within 60 to 90, it's considered normal. Above, within 120 to 140, it's still considered normal. Because not everyone has this ideal blood pressure, which is 120/80. Mine is low, 110/70, but that's my normal blood pressure. So there's no one number that fits for all.
I see.
Which means a regular blood pressure checkup. If you have a machine at home to do it on your own, be good so that you know your all pressure.
Yeah, nowadays those blood pressure machine is quite cheap, so we should all keep one at home. And
so you can do it at home.
So certainly, if we find the blood pressure too high, that is a symptom of heart attack very much. Then we should really go to see the doctor, right?
If you have a very high blood pressure, that doesn't mean that you will have a heart attack.
Right.
But that could also mean that you are moving into getting hypertension.
Right.
So hypertension can lead to stroke. Hypertension could lead to heart attack. So those are the things that you need to monitor. How do you monitor? Your food intake, your exercise, and your daily checkup of blood pressure. Then your yearly health checkup. At the same time, you need to get a consultation from doctors.
How often should we test our cholesterol one? Because cholesterol, you need to do a blood test, right?
Correct.
You cannot do it at home. So how often should we do actually?
Okay. For health checkup, for cholesterol level, we don't really go and check no one goes and check their cholesterol level every month.
Right, of
because
course.
it's insignificant. So what you can do is always make it a habit to do
Right.
the health screening every year.
I see.
Yeah. Yearly health screening should include blood taking and also BP monitor, your blood pressure monitoring, your weight, and the rest of the checkup that comprises into a full comprehensive package. So through that screening, you should be able to know your cholesterol level,
Yes.
and if it's too high, then the alteration of your daily activities, your daily intake will have to take place.
Yes.
If it's too low, also you will have some alteration. Probably you need to eat more good fat instead of the bad fat.
No more McDonald's.
No more McDonald's, correct. But that's the best actually.
Yep. Right. Okay. Yeah.
All right. And your best medicine,
Yeah.
this would be your best medicine.
Right.
Your laughter. You know, you need to have a very happy, your days has to be happy in order for you to be less stressful.
Yes.
When you are stressed, that's where you get all tied up, you get all angry, you know, then you start having all this discomfort of your chest, and then your blood pressure will rise, and then some of us will tend to eat more because you're in stress mode. So when you eat more, usually we eat junk, we don't eat healthy food. So, but then if you're happy, you are able to control what you eat, you are able to control your blood pressure, your stress level. And as you can see on your left side, we have a plate for you. So on your plate, for a healthy person, we need lots and lots of vegetables and fruits, your proteins, and make sure you drink enough water, at least 2 liters per day, and choose whole grain food to improve digestion and nutrition. And I guess the last slide would be on how healthy heart checklist would be. So,
that is a very serious part that I always want to ask. There are so many types of screening services from the hospital. From the very cheap one, a few hundred one, I mean in Hong Kong dollars, to a few $1,000s. I don't know which to choose. What we should always check and what type of tests we should take.
Okay, for health screening, if you ask me, it needs to be your yearly mantra. So which means yearly you've got to do your complete health checkup, your medical checkup.
Yes.
All right. What to choose, when to do, and what do you want to choose usually will come after during that checkup. So let's say your main concern is your heart, or your main concern is your weight, or your main concern is your blood pressure, you know. Majority of the health screening packages has blood tests, heart check, x-ray. Usually it comes with x-ray, your ECG machines where they show you the rhythm of your heart. And also they will also have ultrasound to look into your organs in your body, correct?
Correct.
So if you've done every year, usually when I see patients, my advice would be, if you are 35 and above, always do the comprehensive ones, which includes blood tests. When we talk about blood tests, you're not only looking at your cholesterol. You need to know your cholesterol level, your sugar, your blood glucose, and your kidney functions, liver functions, and all your calcium and thyroid levels, which includes your uric acid, because all these blood tests, it doesn't work on its own. It works with each other. So it complements each other. All right. From there, we should be able to say, the doctors should be able to tell you, like, oh, you probably need to reduce your salt intake, or you probably need to reduce a lot more of your seafood intake because your uric acid level is high and your cholesterol is high. So we want this to be balanced. At the same time, when we do your urine test, it will also include whether you have a lot of sugar or infection that goes on. We will also advise you accordingly. And then At the same time, some packages includes ultrasound of your body, where they look into your liver, your pancreas, your spleen, your prostate, your kidney. From there, we should be able to look into the organs and see if there's any stones in your kidney or your gallbladder.
Yes.
If there's stones in the kidney, it could be one of the reasons, could be lack of water. Stones in gallbladder could mean you've ate too much of McDonald's. At the same time, we will look into your liver, whether it's fatty liver or not. If it's fatty liver, then it's time to stop all food with high fat, oily food, and start eating healthy.
Okay, I think that's what we should really focus in, and yearly screening is a must, I would say, especially people like me over 35 already. And
Correct.
I highly recommend people, also consider going to Malaysia to do this screening, because I have actually visited a few screening centers in Malaysia. They are very well equipped, beautifully decorated. You don't feel like you are going to a clinic. You feel like going to a hotel actually, and the service is really being nice to us and detailing explaining to you in the report. Most important is the last experience I have is actually the report was explained in Cantonese, which is very rare. I mean, in Asian countries that they can do. I think that could be the only countries we can provide this kind of services in Malaysia, right? Yeah. Thank you, Dr. Noor. It was a very fruitful introduction of the heart sickness, health concern, and also the screening services that we should always use in Malaysia, I would say. Today, as I know, your college has arranged us to go visit a place in KL. Can you tell us about what they have done?
All right. Thank you, Michael. I guess that ends the heavy talks that we have today on healthy heart. I'm passing over to YY. She's in Taman Tasik Titi Wangsa. It's a park near KLCC.
Right. Okay.
You can have a look at the beautiful scenery while YY introduce you to the park and the surrounding areas. Right. So enjoy the walk in the park today.
Yes.
And it looks like our weather is also good right now.
Yep.
And have a good day, yeah?
Excellent.
Thank you
very much. Thank you for your time, Dr. Noor. 早晨啊，Y Y，哇！你嗰度好靚喎地方。咁啊，啱啱同Dr. Anna 傾完偈嘅，咁啊就話心臟咧，咁你知我係肥仔嚟㗎啦，咁啊我仔又係肥仔啦，咁啊我哋兩個咧就而家就需要做好多運動啊，咁啊所以成日揸咗架車咧就咗去迪士尼附近嗰個迪欣湖啊，你下次嚟香港我帶你去睇下都好靚。好。咁我去踩單車，咁啊我最中意去呢啲咁嘅地方，outdoor嘅地方行下。你今日帶咗我個地方係咁樣喎，即係我見到好靚喎，又見到雙子塔，又見到 KL Tower。喂，你喺邊度先？今日帶我哋去邊度玩㗎嘛？好啦。我同大家簡單介紹一下啦，呢度就叫 Taman Tasik Titi Wangsa， 係喺吉隆坡附近啫。呢度你睇到成個湖係其實係吉隆坡嘅東北邊緣嚟嘅，係成個地方咧係有50英畝咁大嘅。係你都知馬來西亞其實係英國嘅殖民地啦，以前係咁樣。呢個 park 咧就喺之前就留到而家啦。哇！係吉隆坡最古老嘅一個 park 嚟嘅。I see。咁其實佢係啦，我見到個環境都好靚喎。係啊，你睇到後邊嗰個噴泉冇啊？梗係啦，有啦。係呢個噴泉咧，係可以噴到100米咁高㗎。哇！咁犀利。OK。咁啊，其實入邊仲有啲咩可以玩咧？因為嗱，你覺得啱嘅，即係。成日都講啊，香港係好鬼細嘅。香港最大個 park 叫維多利亞公園，就其實都好鬼擠擁，好鬼多人嘅。我見你呢度咁耐啦，其實都唔會好多人，因為始終你馬來西亞地大物博啊。咁其實呢啲公園，呢個公園係咪政府嘅？係咪公立啫？係啊，呢度你直頭就係喺個 main entrance 入嚟咧，你就可以用呢度嘅設施。唔使錢㗎啦。唔使咁好似我哋香港維多利亞公園，不過我哋用所有嘅球場嗰啲都要錢嘅。咁呢度係咪都有呢類型嘅facility？係啊，呢度有網球場啦，你可以喺度踩單車啦，你走步啦，仲有兒童嘅遊樂場。係入邊好似仲有一個迷宮花園㗎。 哇！
但係
OK
呢個地方就係太大啦，如果我而家帶唔到你哋去嗰度。
明白。喂，咁啦，其實如果我帶小朋友啊，帶埋個屋企人過嚟咧，咁可唔可以真係花到一日時間喺度啊？會唔會喂冇嘢食啊？餓死咗喺度。
梗係唔會啦，你可以花一日時間喺度嘅，因為咧我哋呢度仲有觀景塔啦，有涼亭，你可以喺度野餐都得嘅。
哦，
同埋湖邊旁邊咧都仲有餐廳，係你喺呢度唔會餓親嘅，一定。
OK， 喂，咁樣啊，其實即係過去嗰3集啦，你都帶咗我哋去不同嘅地方啦，由即係郊外到市中心，甚至乎上次市中心一個喺河邊可以浸腳嘅餐廳都去得到嘅。馬來西亞嘅旅遊地點咧真係好鬼多嘅，即係亦都好有特色嘅。咁啊，好多謝你喺呢幾集帶我哋去睇唔同嘅地方。咁啊，希望嚟緊嘅再有機會帶我哋去唔同嘅埠再睇，好唔好？
一定。
好多謝晒你先，
好，唔該晒，
就咁先，拜拜。
Thank you，Michael，拜拜。